Hi, we've all heard the old adage, you are what you eat.
Well, it turns out it's not too far off. The food you eat actually can impact your overall health, your sleep habits, your energy levels, and more.
So stay tuned for this week's Health Talk. We'll teach you how to eat.
We're
up
up
next. I'm Dr. Eric Mazer. Today we're going to talk about nutrition and cancer prevention, very important topic, with Cindy Tyler. She's the breast navigator at New Milford Hospital, and Michele MacDonnell, clinical nutrition manager at New Milford Hospital. So welcome. This is your first time on the show, and it's really good to have people from New Milford down here.
Absolutely. Welcome to the show.
Thank you so much for having us. We're so excited to be here.
So maybe you could just start off by sharing with our viewers a little bit, if you don't mind, what made you interested in nutrition?
So, I always wanted to help people, and in college I just found it really interesting how the foods we eat can affect our bodies.
You ate food in college?
I did eat food in college, not always the healthiest choices, but I did learn that.
Yeah, healthy food?
So,
you ate pizza and beer, that's...
Right, so I wanted to help people and make a difference, and I found, through nutrition, it's just amazing how small changes that we make can really make a big difference. So, and Cindy and I have been getting to work together at the hospital, and that has been so great. We've learned so much from each other. As we're
You're
learning.
a dietitian, is that right? So you are really
Yes, I'm a
foodie.
registered dietitian nutritionist. Yes, I love food, so I love to eat food. I love to teach people about food. It's great.
When you go into a restaurant, are you highly critical of what they put on the plate in front of you?
I love to see lots of color and quality over quantity when I go to a restaurant, but I try to also enjoy food and see the benefits of it, not to be overly critical. So I feel like we can enjoy all foods in moderation.
So you're able to put your professional hat aside and enjoy
Absolutely. And there's so many great restaurants now in Connecticut that have that farm-to-table cuisine, which is just amazing, and use ingredients from the local farms, not only because they're good for us, but they actually taste better. So it's a win-win.
What's been your background in nutrition?
So my background is I'm a cancer navigator, and I worked at the Diebold Family Cancer Center in the infusion area. And then I shifted over to breast Care Navigator, which I got more involved with breast cancer patients. And many of them, when they first get diagnosed, their question is, what did I do wrong? How should I behave in the future? How should I proceed forward after I've completed my treatment? And as I started getting more involved, I started realizing how much nutrition plays a role in cancer prevention and also cancer survivorship. So Michele and I were on a committee together for community outreach, and we started talking and realizing that our two fields have gone from being kind of isolated from each other somewhat to recently really converging. And so I can't talk about cancer prevention or risk reduction for survivors without considering nutrition. It's a huge piece of the picture for those patients.
Well, it's sort of amazing, as our healthcare system develops and we get these capacities to treat all these diseases, we're also learning that the simplest of things, diet and exercise, have a broad effect on so many illnesses.
Absolutely.
So today we're going to be talking about cancer. We used to think about it just in terms of heart disease.
Yeah.
I know that there's data now about exercise and dementia, which is sort of, nothing prevents dementia except exercise and healthy diet.
Yeah.
And yet it seems too simple. We'll spend hundreds of thousands of dollars on a drug, but we won't eat right and exercise. So I think today we're going to talk a little bit about this evolving area of diet and oncology, which really is a very strong tie-in.
Yes, absolutely.
So I think maybe the first tie-in was breast cancer. So tell us a little bit about what we know about diet and breast cancer.
Well, as research has gone on, there is more of a link between diet and breast cancer, particularly postmenopausal breast cancer is linked with weight gain after menopause, and obesity is linked to postmenopausal breast cancer as well as some other cancers. But with breast cancer, most people who get breast cancer early stage have a long time to survive. In many instances, they live a full life after treatment. So that length of life, you want them to have cancer prevention as a background to their lifestyle choices and to their eating choices. So if somebody has breast cancer at age 50, they're likely to live till 70 or 80.
Longer, yeah.
Yes.
Yeah.
So they need to know how to live and how to eat and how to be active for the rest of their lives in a way that's going to reduce their risk.
What is the connection between obesity and cancers? Why is there a connection there?
Obesity is shown to just increase the inflammatory process in the body, so that makes the cells in our body just under more duress, I would say. And obesity is also linked to kind of like an insulin resistance issue, and insulin resistance is also kind of related to an inflammatory process in the body, fat storage in odd ways, and so the body just is under, I think, a lot of stress when it's obese.
Is this link between cancer and obesity generally known among our population, or do people, are they surprised when you start to talk about it?
I think a lot of people are surprised by it, and we're learning more and more as we go on, and people are starting to realize how important, staying at a healthy weight, being physically active, and following a mostly plant-based diet can affect their cancer risk. That's what the message we're trying to get across, is that there's simple things you can do. But I don't think people generally think, oh, if I'm obese, it's going to increase my risk of certain types of cancers. We know heart disease, diabetes, absolutely. But we're learning more and more, and that's definitely the message we're trying to get out.
Right. And recent research does show that about 50% of Americans do not know that there is a link between obesity and cancer.
And what's so interesting, too, is that the diet that's best to prevent diabetes, and the diet that's good to prevent cancer, and the diet that's good to prevent heart disease is the same diet. It turns out
that is a fantastic point.
That we're not dealing with complexity here.
It's all
we're dealing with a simple,
Yep.
I shouldn't say simple because I've got too many
all one diet.
but a straightforward lifestyle recommendation
Yep.
that seems to be broadly true for your overall health.
Absolutely, and I tell people that all the time. The same recommendations for weight management, for cancer prevention, heart disease, diabetes, some little tweaks here and there for individual people. It's really all the same message that we're trying to get across.
So what is healthy eating? I'm sorry, Andrea, I stepped on your line.
Yeah.
What's healthy eating?
One of the things that we're looking at...
The opposite of what I do. Go ahead. And I'm saying, I try, but I'm not very good at it.
One of the main things I try to get across to people is you don't want to go on a diet, because when you go on a diet, you go off a diet. And we really want to focus on what is healthy eating for the rest of your life. And if you're eating mostly a plant-based diet, you might see weight loss as a benefit of that, which is fantastic. The American Institute of Cancer Research really recommends following a plant-based diet. So if you look at their recommendations, they recommend 2/3 or more of your plate at every meal should be plant-based foods, which is your fruits, your vegetables, whole grains, your legumes, like nuts and seeds and beans. And then you want to keep
So cake and cookies, which are plant-based,
Right.
don't count?
They do not
Sugar
count,
has
though. No. And
plant-based.
one of the other recommendations
Chocolate's
is
a vegetable?
to limit processed foods, right? To limit processed foods and foods that have a lot of sugar added to them, including sugary beverages. The other thing that we want to do is we want to keep 1/3 of your plate or less from animal foods and dairy products. So we can have those in our diet, but we want to limit the amounts of them and make healthier choices. If you look at the My Plate guidelines, they're very similar. They recommend, half of your plate fruits and vegetables, 1/4 of your plate can be your whole grains or starches, and 1/4 of your plate can be your meat or protein foods. So I think looking at those recommendations, they're both very similar.
How do you?
A little bit about the science behind that. So the science behind animal and dairy products is the focus on the protective benefits of a plant-based diet, or on the risks of an animal-based diet, or both?
I think it's actually both, and that's a great question. We know that eating too much red meat, more than 18 ounces a week, can actually increase our risk for certain types of cancer, specifically colorectal cancer. We also know that any amount of processed meats increases our risk of colorectal cancer. So part of it is that protective benefit. Our animal sources are also where we get most of our saturated fat in our diet, which is one of the unhealthy sources of fat and does provide a lot of calories. So by limiting the amount of animal products, we're decreasing our saturated fat, we're decreasing our calories. Then you have the protective qualities of that other 2/3 of your plate, which is your fruits, your vegetables, and your whole grains, your nuts and seeds, your beans, and all of those foods. They're generally very brightly colored, they're strongly flavored, they have lots of phytochemicals and antioxidants. They're very high in vitamins and minerals, and they're also high in fiber. So that fiber fills us up a lot longer. It's good for our heart and our digestive systems. And they're also lower in calories. So generally when we're eating more of those, not only are we getting these nutrition powerhouses, but we're also eating less calories, which again helps us to stay at a healthier weight, which decreases our risk for cancer. So it's really looking at, sort of all foods, and we don't want you to exclude any food from your diet. So a lot of these fad diets out there might say avoid this or avoid that, but you really need a balance of all foods. We do need healthy fats like our olive oil, our avocados, our nuts and seeds, canola oil, but we want to do that in smaller amounts. So just having, and enjoying the foods that we're eating.
How about stacking and how, does it make a difference what time you put in your calories? I know there was some discussion that it's better to eat your calories early. My parents used to say don't eat right before you go to bed.
Right.
Is there science backing up one or the other way to eat?
It's your total
Or eating
intake.
6 times a day rather than 3 times?
So, that's a great question. I think you have to look individually what works for you and your schedule and your lifestyle. But absolutely, it's your total intake for the day that matters. However, if you're going all day without eating and then having one large meal at night, your metabolism is slow all day long. And when you finally eat at nighttime, your body's hoarding those calories because it hasn't been fed. Versus eating, at least 3 meals a day. I personally encourage small meals and snacks. I just think it's better for our metabolism. We make healthier choices when we're not starving. Eating breakfast is so important. 9 out of 10 people at a healthy weight eat breakfast every day. It gives our brain energy, it gives our body energy, and it just sets us off on the right track. So eating a good breakfast. I find a lot of people who snack late at night, it's because they're not eating enough earlier in the day as well. So when we eat a good breakfast with some whole grains, some dairy, some fruit, that gets us on the right track. Healthy snacks, not skipping lunch, really makes a big difference.
With the idea behind the Atkins diet, which has been out there,
Mm-hmm.
which talks all about fats and meats and protein and avoiding all kinds of carbohydrates, any kind of sugar, even plant sugar. And in a way, it is more satiating. I actually tried it, and it's short term, but it's very satiating. How do you fit that into? Because you could argue that those things that we shouldn't be eating are also those things that fill us up more easily and keep the insulin levels lower. How do you fit that in?
Well, I would defer to Michelle on that because she's really all about kind of the lifestyle of fitting all this in, but I do feel like there's places for certain types of diet that are recommended by people's physicians, and then how people eat during treatment sometimes is very different than because we're managing symptoms. So sometimes during treatment we make different recommendations, but for prevention and survivorship we recommend the plant-based diet.
But we
over the others.
Yep, absolutely. But at the same time, you are allowed to have some protein with each meal. We do want to encourage some healthy fats so that you have those satiating qualities with your foods. The fiber, though, definitely can fill you up and be very satiating. And I actually encourage all of my patients or people that I'm counseling or working with to have a little bit of whole grains at each meal. And a lot of times the grain foods really kind of are seen as like the enemy, or they get a lot of bad press out there. If we're choosing the right grains, and they're whole grains, things like 100% whole grain bread, maybe brown rice, quinoa, oatmeal, a high fiber breakfast cereal, but a little bit of whole grains with each meal gives you that consistent source of energy, prevents your blood sugar from dropping low, and it kind of holds you throughout the day. It's also giving you that fiber as well.
And we need to take a break now, and I know that you're promising us when we come back, you're going to tell us how to do this.
Absolutely.
Not what to do, but we're going to teach you how to eat right. And that'll be really helpful to all of us. So we'll take this short break, and we'll be back to talk more about nutrition and cancer prevention.
Don't go away. We're back with Cindy Tyler and Michele MacDonnell. Welcome back.
Talking about how good diet is good for you. And we talked a lot in general, but maybe we have asked Cindy to say a little bit more about diet and cancer. That it really can help prevent several cancers, but even if you have cancer, it can be useful.
Right, so the research does show that there are foods, there's over 60 modifiable foods and lifestyle activities that have played a role in reducing someone's risk for cancer. So when someone's been treated for cancer, they certainly don't want to get that cancer back if they've been sufficiently treated, and they also don't want to get other cancers. And so what we want to remind them about going into survivorship is that we not only want to reduce their risk for a recurrence of the cancer they were treated for, but reduce their risk for other cancers that they could be susceptible for, such as colorectal cancer and the association with eating processed meats, intake of highly salty foods and nitrates, and how that's associated with stomach cancer. So just because they've been treated for one cancer doesn't mean that our treatment focused on preventing all cancers that they might be susceptible to for one reason or another. So people often say to me that I don't have any cancer in my family, so I must not be susceptible to getting cancer. But there's other environmental factors that we can't control. The biggest risk factor for cancer is really age, so we can't prevent that we're getting older.
And I know that most women who get breast cancer don't have a risk factor.
Right.
So although risk factors predict breast cancer, not having one is not protecting you from that.
Right, exactly. That's true.
And I think one thing we always try to get across too is it's never too late to make healthy changes, and even little, like small changes make a big difference. So whether it's you start getting more active and going for a walk every day, maybe you start eating more fruits and vegetables, trying to increase the proportions of fruits and vegetables on your plate. You start adding in, switching to more whole grains or eating less processed meats. All of those things can add up to a big health benefit, and it's never too late to get started.
So. The other thing which I think we've learned with smoking cessation is you may have tried 20 times before, but it's worth trying the 21st time and the 22nd time.
Absolutely.
Because it does finally stick for many people.
Mm-hmm. Absolutely. That's a great point too, is that a lot of people I will see have come to me and said, oh, I've tried this diet, I've tried that diet, and we know diets don't work.
Right, that's something I've learned, and that's so true.
Right.
If the concept of a diet is that it's a time-constrained period where you're going to do something differently to lose weight, and then somehow you go back to your old habits and you'll be thin for the rest of your life.
And that's not true. And a lot of people, they gain the weight back, and that's even more unhealthy for them. So something that you can do, all of the hospitals in our network have outpatient dietitians where you could make an appointment and really get a personalized meal plan. I always try to make sure that it's something that works for my clients. If I tell you to eat this, if you don't like these foods, you're not going to eat it. But finding out what works with their lifestyle, what foods they like to eat, and how can we improve upon what they're already doing is really important.
And Cindy, I think that's a really important point. So you're often dealing with people who are already going through very stressful life events, and maybe asking them to make behavioral changes. How do you do that? How do you guide people so it's not overwhelming?
Right, so some people at that point, they reassess their life. They kind of try to reassess priorities, and some people come to the conclusion that it's about my choices now, and that's the only thing that you really ultimately have control over. Like we said before, you don't have control over your sex, over your age, over some of your environmental factors, sometimes even how you were parented and what you were taught about food and all sorts of health behaviors. But now is time where you can have control back of those types of things. So when people get that kind of control and say that I can, on a daily basis, make some choices that are good for me, and it doesn't mean that if you fail today, you can't then again say, well, tomorrow I'll try that new vegetable, or tomorrow when I go to the grocery store, I'm going to walk the perimeter of the grocery store and not go. We always joke and say that the inside of the grocery store, the rows, are the dangerous areas, but if you stay on the outside of the grocery store, it's a little safer with the fresh products and the frozen vegetables and the fresh. That
works for women, but for most men who have never stepped foot in a grocery store, well, I'm just really speaking for myself. But no, I do realize now that the produce is in the, but the eggs are on the outside too.
Yes.
The eggs, the milk, the cheese.
Another great thing too is that as we're getting into the spring and the summer here in Connecticut, there's so many great farms. The local, the farmers markets. You can go to local farms. A lot of people have community-supported agriculture shares, and that's a great way to get healthy produce, lots of antioxidants. But it also tastes better. And I have a lot of people I work with too who say, well, I don't like fruits and vegetables. I said, well, you're not eating the right ones. And even my own children, they know if they have tomatoes, if I have tomatoes in our salad, they want to know, Mom, are these from the store or are these from the farm? And if I tell them they're from the store, they won't eat them. But if they know it's from the farm, they dig right in, because even they know it tastes better.
Going back to the cancer patient, it is such a moment in someone's life. It's a singularity in their life. a lot of people use that as an opportunity to make change.
Absolutely.
Rather than, but I guess the question is, are enough people able to turn that into a positive, or is it so overwhelming that for a lot of people it becomes a negative? And the second thing is, will people do it for themselves, or do you find it more effective when they're thinking about themselves, or when they think about their family, and that I have to do this not for me, because I've got to be here to watch my daughter graduate from high school or get married or something like that?
I think it's multifactorial at the issues that play into people's choices and what motivates them. So we try to find out what is important to those people. And if living for their family to witness a wedding is important, then we say that's great. That is your motivation. Sometimes it's motivation enough to say that I'm going to be the example in my family, and I am going to stop smoking, and I am going to drink water instead of sugary drinks, or drink healthier choices and eat healthier food, and I'm not going to eat out at every opportunity and buy some highly processed product that's readily available. So some people find it motivating to say, I'm going to set a new example. Some people find it very fearful, and I think in cancer care we have to recognize that as people have been treated, when they come out of treatment, they're just not going to like all of a sudden bounce back and be their old self. They've got some sort of a version of a new baseline that they're functioning off of. Sometimes people get very frustrated at that new, what's their new normal? They resent that they've got a new sense of normal, but we say that your new normal can become a platform that you can grow from and make improvements from. And then also recognizing that as people come out of treatment, they might have side effects that make it challenging for them to adopt exercise programs. So we do encourage something as simple as walking to the mailbox, walking up and down your own flights of stairs, walking as far as you can when you park in the parking lot. But some people have some side effects like neuropathies that make exercise challenging for them. So we want to recognize what some of the long-lasting side effects are, and then not make people feel guilty for not being able to just jump back into some sort of exercise program, but start slow. And the main thing is to stay active through treatment, and then gradually increase your activity after treatment, and that helps fatigue. So the main side effects, I would say, are fatigue, which is a motivation killer for even making healthy choices. But if they can just regularly exercise, even on a small scale daily, that helps combat fatigue. And then when your fatigue is dealt with, then sometimes you're resting better when you're exercising and eating right.
And we have less than a minute left. So are there any sort of the one thing you've each seen, if I'm sure it's more than one, but it's sort of the one piece of advice you can give people at home who really want to begin to change their lives? So, what's the jackpot?
I think for me, it's not to feel guilty, and to, it's okay. We want to enjoy eating, and to really take your time with your meals, sit together as a family, enjoy the nourishment that the food is giving us, and try to think positively about food. I'm eating this because it's good for me, not I can't have this because it's bad, and you don't want to deprive yourself. So if eating a cookie once in a while is going to keep you on track most of the time, that's okay, but try to think of in food as a more positive light, and picking those healthier choices and feeling good about it.
Right. And I think for me, it's where are you going to go from here, not where were you at, but where are you going to go from here, and what are some new goals and objectives that you have for your life, and what are some things that you can take control back of and enjoy in the process. It should be exciting and fun to try new foods and new activities.
It's wonderful advice. Thank you both so much. And remarkably, our time is over for this segment. But
we're going to ask you to stay on set to help us answer the question.
Absolutely.
And Andrea and I, we're going to leave, but we'll come back after today's health question after these messages.
Let's take a look at some of the upcoming events sponsored by Western Connecticut Health Network. question is, I'm on a diet and eating healthfully. Do I need to exercise too?
Is it diet and exercise or just diet?
Diet
Both.
and exercise.
Yeah,
Both
absolutely.
together.
We were hoping you wouldn't say that.
So the data is actually mixed as to whether diet alone can be as risk-reducing as diet and exercise, but more emerging data is showing that exercise in and of itself is a cancer risk-reducing effort that you can make or change that you can make in your life.
And it's amazing, as I said, what I've seen with dementia is that's the only proven method to reduce the frequency of dementia.
Yeah.
Exercise.
Yeah,
Who would have
absolutely.
guessed?
Right.
You know, it lowers your blood pressure, it brings down your blood sugar, it helps with your blood lipids, it gets your blood circulating, you know, and if you're exercising, it helps to burn calories and build lean body mass. So
Also helps your immunity.
And it doesn't have to be 2 hours at a gym every day.
not at all.
No,
No,
it can
that's right.
be
I think some people.
as simple as walking your dog.
Yeah, absolutely. You know, 30 minutes, 5 days a week is really what the recommendation is, but that could be 10 minutes 3 times a day. You know?
And there are ways to build that into your day. Walking stairs instead of taking elevators. You mentioned parking the car further apart.
Yep.
Standing, we just were with somebody yesterday, standing at your desk rather than sitting at your desk.
Make more trips back from the car when you're bringing
Right.
groceries
Yeah.
home
Taking
rather
the
than
stairs.
I mean,
fewer.
look at those as
Yeah.
opportunities to exercise rather than nuisances where you'll spend more time circulating around the parking lot looking for that closed space than walking the distance in.
That's
And
what I
knowing-
remind myself when I'm cleaning the house and I'm really not enjoying it. I'm like, at least I'm getting some exercise right now.
And knowing that it makes a difference. It's
does.
not something that's not going to benefit you. So any movement.
And any final thoughts?
You know, I just thank you so much for having us.
Yes.
And,
Yeah.
you know, Cindy and I, again, we always like to let people know what you can do and to
Yeah.
really put things in a
And
positive way.
for me, I'd emphasize it's a lifestyle change. It's not a diet.
No.
It's not a sprint.
Yeah.
And that changes are going to be slow.
Right.
You know, 20 pounds in 2 weeks
It's
is
not
ridiculous.
It's not sustainable.
No.
And you want to make changes that you know that you can live with and that you feel good about so that they become second nature
Becomes
to
part
you.
of your life.
Yeah, absolutely.
And
Wonderful advice. Thank you both so much for
You're
being
welcome.
for answering the
Yeah,
question.
that's
and
really
being on our
fabulous
show.
advice. So if you at home have a question you'd like to ask on Health Talk, please contact Andrea and me at healthtalk@norwalkhealth.org.
We'd like to thank our guests Cindy Tyler and Michele MacDonnell for coming on our show today and giving our viewers such great advice.
So we'll see you next week on Health Talk. Eat well and exercise.